KCBS, in partnership with UCSF Health, presents As Prescribed, a weekly conversation with leading medical experts from UCSF Medical Center and UCSF Benioff Children's Hospitals.
Hello and welcome to As Prescribed. I'm Alice Wertz. Climate change is the single biggest health threat facing humanity today. Health professionals all over the world are responding to this unfolding crisis. Joining us today is Dr. Meghana Gadgil. She's an internal medicine specialist and associate professor of internal medicine at UCSF. Additionally, she's the director of innovation at the Better Lab. She has been working at the intersection of health equity, climate change, and global health for her career. Thank you so much for joining us today, Dr. Gadgil.
Thank you so much for having me.
Tell us how you got involved in environmental health and climate change as it relates to public health.
Sure. So I studied conservation resource studies as an undergrad, and even at the time, I wasn't sure whether I wanted to pursue medicine or think about environmental health. And ultimately, I decided I love working with people so much, and I ended up going to medical school. But all along, I had this thread of thinking about how people interact with their environment, what keeps them healthy, how they think about food supplies, transportation, shelter. And as I got more engaged in global health and worked with vulnerable populations all around the United States and around the world in many parts of, essentially on almost every continent, I recognized more and more that we couldn't talk about global health and health equity without thinking about climate change. The inexorable impacts of climate change are not borne equitably by communities around the world. And when we think about health, we have to think about the health of both people, their communities, and the environment in which we live.
So what are some of the primary impacts of climate change on an individual's health?
The impacts of climate change are going to impact hundreds of millions of people around the world, and we're already seeing that today. More frequent and dangerous weather patterns have both first order, as you identified, and some second order impacts. When between 2030 and 2050, climate change is expected to cause approximately 250,000 additional deaths from just four things: malnutrition, malaria, diarrhea, and heat stress. And there are going to be many other causes that are going to exacerbate morbidity and mortality around the world. When we think about the health impacts of climate change, they fall into a few major categories. So we think about extreme temperatures, extreme heat, and extreme cold. And those are estimated to kill more than 5 million people a year, just the temperatures alone. Air pollution, as a second cause from wildfires, creates new and worsens existing respiratory and cardiovascular disease. PM 2.5, which is fine particulate matter, resulted in 1.8 million deaths in 2019. Floods, of course, cause drowning, injuries, and waterborne disease, but can also cause harm through landslides and deaths. In 2016, globally, 74 million people were impacted by flooding. Hurricanes and cyclones are also more intense and more frequent with climate change, and they create a huge swath of death, destruction, and displacement in their wake. And I think climate-sensitive diseases are actually an excellent illustration of the intertwined relationships between environment, human health, and health systems. There's been a sharp rise in malaria, dengue, and many foodborne and waterborne diseases due to the expanding geographic range and changes in seasonality due to rising temperature and precipitation and deforestation and air pollution. Endemic infectious diseases and novel disease outbreaks are all going to likely worsen due to favorable conditions for vectors and pathogens. And then we can't ignore the mental health impacts from these profound disruptions. Flooding, droughts, extreme heat, alterations to the natural environment, geographic displacement all cause a huge amount of stress, anxiety, depression, PTSD, aggression, interpersonal violence, and weakened social cohesion and the breakdown of interpersonal relationships, both of which are really important to maintain resilience through times of difficulty.
Yeah, we're definitely not unfamiliar with that here in California with some of the huge climate issues we've had with fires and whatnot. What are some of the secondary impacts of climate change?
Sure. So when we think about second order impacts, the health consequences of wildfires, hurricanes, droughts, and floods can also lead to things like forced migration from failed crops, disease, and political unrest. And all of these have important economic and social consequences that indirectly and directly impact the health of individuals, families, and communities. Let's talk about displacement briefly. Each year since 2008, more than 20 million people have moved due to weather-related events globally. In extreme cases, entire populations will need to move because they are living in climate vulnerable areas and their livelihoods are no longer tenable there. The Internal Displacement Monitoring Center calculated that disasters triggered over 60% of the internal displacements in 2021. So that's 6 million people. The overwhelming majority of people who had to move were from weather-related patterns, and lots of them were exacerbated by climate change. Another big area is going to be political unrest and conflict. Displacement can spur conflict when people are struggling for more scarce resources like water or arable land. And you can't really talk about climate without talking about equity. Climate change really amplifies disparities in access to and the quality of care along racial, ethnic, gender, and socioeconomic lines. Poor people and people of color tend to be at the greatest risk of health harms from climate change, and they tend also to be the communities who are contributing the least to greenhouse gas emissions.
Seems unfair. What are some of the systems that we can plan for the future to address this impact of climate change on health?
Sure. Well, let me talk briefly first about how we think about health systems and their impact on climate change and from climate change. And that helps us think about how we might approach a solution. The health impacts of climate change are twofold. So health systems both contribute to climate change, which we'll talk about momentarily, but they're also absolutely essential for climate resilience. Climate change threatens the ability of health systems to deliver safe, effective, and efficient care. And it puts access, quality, and the financial viability of health systems at risk. When we think about access, the intensification of extreme weather events obviously results in lots of disruptions, which we've seen here in California. Hospital evacuations, facility closures and damage, power outages. If you remember in recent California wildfires, 250 hospitals had simultaneous power outages, profoundly disruptive. Transportation disruptions can also contribute to problems with the health system. You can't get an ambulance to where you need to go. And then displacement of health professionals means you can't get the clinical staff with the expertise you need to provide the care they want to provide. And the implications of this, when we think about access, we're talking about physical access and financial access to care. We have worse patient outcomes. The healthcare workforce is more unstable because they themselves are contending with the impacts of climate change on their own families. And these are putting us with greater vulnerability to further stressors. Another dimension is really care quality. When hospitals close, others are stretched beyond capacity. Hospital overcrowding, we know, is already associated with decreased care quality, increased morbidity, and increased mortality. Another dimension are supply chain disruptions, where you are losing the ability to access critical medications or devices. If you remember in 2017, Hurricane Maria damaged a key saline, which is a key intravenous fluid we use in medicine, a saline manufacturing facility in Puerto Rico. And we had national shortages of saline because of this one disaster. And the educational gaps for health professions. When there's a natural disaster and you can't train the nurses, pharmacists, respiratory therapists, and physicians you need to provide care, those students are getting a gap in their education and not able to move forward in developing the skills they need. When we think about care quality, you can't talk about that without thinking about the health workforce. Frontline clinicians have felt the physical and mental toll of climate change very acutely. It's very disruptive to our lives, and it makes our jobs harder, and that can contribute to burnout. Globally, nurses, doctors, and other health professionals have been leaving the bedside. It was a process that already had started before COVID, but it started much more aggressively since then. And there's also been a brain drain where people are leaving low and middle income countries for better opportunities elsewhere, creating a gap in the capable workforce in those areas. Finally, we have to think about cost and financial viability. More patients need care due to the factors we talked about with all the health impacts. But when you have a new or an exacerbation of a climate-sensitive condition, you have injuries from a natural disaster, all of this pushes up healthcare costs, and health systems have to absorb these immediate impacts and care for sicker people for a longer term. So these are all the ways in which health systems are impacted.
Definitely a pebble in the pond kind of impact with climate change and healthcare, delivery, infrastructure, and ultimately patients at the end of the day.
Yeah.
Fascinating topic. Thank you so much for your work in this field, and thank you for joining us today on As Prescribed, Dr. Gadgil.
Thank you so much for having me.
Our guest has been Dr. Meghana Gadgil. She's an internal medicine specialist as well as an associate professor of internal medicine at UCSF and director of innovation at the Better Lab. She's been working at the intersection of health, equity, climate change, and global public health. I'm Alice Wertz. Thank you for tuning in to As Prescribed.
As Prescribed, every Thursday at 1:30, right here on the Bay Area's news station, All News 106.9 and AM 740 KCBS, and streaming on the Odyssey app. The proceeding was sponsored by UCSF.